everybody, this is Bandit. He is getting neutered, which is awesome. We always like to do it the sooner the better. We also are doing a dental add-on. He does have some plaque and tartar on those back teeth. So I discussed with the owner while we're sedated, we might as well just do both at the same time so we don't have to resedate the pet later on. Dental procedures are extremely important, can affect the liver and kidney, so we like to clean the teeth as frequent as possible so it doesn't have later effects in life.
For right arm, I'm trying to get all the hair around it. Your tongue, there's here, or there's no hair in the way.
Unless it's within the box. No, it comes like... To prep for surgery, we did have to intubate, which is the tube that you are seeing. That is to make sure that he is connected to oxygen the entire time he is in surgery. So we want to make sure that we are breathing well. Once we do move him to surgery, then he will be hooked up to the leads, which will monitor his heart rate, respiration, his pulse, his temperature. We do monitor them the entire time to make sure that their vitals stay good and making sure that they're handling the anesthesia okay.
He's matted, so it's hard to cut his hair without going through it. I'm trying to get all the hair around it without it going near the incision site. RA for right arm. The right arm now is down. And then the left leg. And then the left arm. These are to monitor the heart rate and the respiratory rate to make sure that the patient's vitals are good under anesthesia. The SpO2 monitor, it allows us to see how much oxygen he is receiving throughout the entire surgery. And you hook it on their tongue, their ear, or their foot. And then we're going to flip him on his back and tie his feet up. It's a safe restraint to make sure that during the procedure he stays stable physically for the doctor, because if she cuts and his body moves, there could be potential for damage, and we of course are going to prevent that as much as possible. This is Maricamp, an anti-inflammatory pain medication that we give to certain patients depending on their chemistry results of the kidneys and the liver. Sometimes we give carprofen injection, but this one we're giving Maricamp. And it just goes sub-Q under the skin. Make sure you pull back, make sure you don't get any air. We're going to do the surgical scrub. First you take the first chlorhexidine scrub and you just get all the extra bacteria off. Just scrub it. Make sure there's no hair in the way. And then you can take your second one and you start to do in a circular motion from inside to out. And then you do that with the scrub, and then you do that with an alcohol wipe after. So you do that 3 times, and then you spray it with iodine, and then they're ready to go under anesthesia.